All right, so we're back and we're about to apply one of these tourniquets. And again, today we're focused on only the tourniquets that have been approved by the Department of Defense, specifically the Committee on Tactical Combat Casualty Care. It's a good indication of quality, and anytime we're dealing with medical equipment, we should be choosing quality and effectiveness over cheap and convenient, right? And so all three of these tourniquets employ what's known as a windlass rod. Just so happens that the three approved all involve the belt, the strap, and a windlass. And they all have some similarities, but they have a few differences that we'll point out here in an upcoming video for you to talk about these three approved tourniquets specifically and their little nuances and some points about them that you too may also find fantastic. But today I just want to cover the basics of applying a tourniquet and getting it on and making it as effective as I can. Now this assumes I have a tourniquet in my kit and I'm ready to go. If I don't have a tourniquet, then obviously I'm defaulting back to direct pressure, and again we'll try to talk about that in a future video. But I'm just going to choose the one that I'm most familiar with, I've trained with the most, I've seen the most out in the field in training, I've seen the most on kits, on persons, whatever. It happens to be the one I carry. I'm not saying this is the best of the three. I'm saying for me, I have the reason to choose this one because it's the one that I'm technically most familiar with and I've trained with the most. You have to make the decision what type of tourniquet or which one of these three approved tourniquets, which I highly recommend, you're going to use. This just happens to be my go-to, at least up until this point. So just some pointers about putting on the tourniquet. We've talked about staging. We've talked about the importance of blue. We'll let you go back and watch those videos. If I'm working on my patient, someone that I've decided to render aid to, I want to have some empathy for them, right? As good, or at least we would like to be good aid providers, it's important to have empathy. We always say bedside manner. Well, that's part of it, right? The other piece is having genuine empathy. So anytime I'm going to put on a tourniquet on someone, I want to let them know that it's going to likely be a bit uncomfortable and might hurt them some. That's just a courtesy, if nothing else. Tourniquet application is not comfortable. When and if you do go through some training, which I hope you do, and I hope you come to see On Guard Solutions for that training if you're in the area, you need to consider empathy and let your victim know that it's going to be uncomfortable. I'm going to let that sit there for just a minute so I'm not tied up in a tourniquet the whole time I'm talking. So let's just say I'm working on my arm, obviously. Let's just say I have a severe laceration here, or maybe I've lost my forearm, I've lost my forearm midways down or closer to my elbow, whatever the scenario is, think about it. The first thing that I've got to consider is where do I place that tourniquet in relation to the injury. I'm always going what I call north of the injury, this way. To me, this is south. But I want to go proximally, that's the technical term. You have proximally and you have distal. And the distal is further away from the trunk or the heart. Proximally is closer to the trunk or the heart. So that's to remember. I always jokingly say it needs to go north of the injury, but technically it's proximally. So it's important to get the tourniquet 2 to 3 inches above the injury. What I don't want to do with a tourniquet is place it over a joint. I also don't want to put a tourniquet over pockets with phones, keys, or pocket knives, that sort of thing, because those objects in the pockets prevent the tourniquet from applying the pressure that it needs to do to occlude the blood flow. So let's talk about how a tourniquet works for just a minute. As you can see, There's generally some sort of band, and again, they're all different, but these three are pretty close in nature of how they function. The band goes around the extremity. When I cinch that down, I'm beginning to put circumferential, I have a hard time saying that word, I don't know why, but what a tourniquet does when you get it wrapped around the extremity, the limb, is its goal is to put even, nice, circumferential pressure on that extremity to shut off the blood flow. And so, you know, there's skin, there's muscle, meat, you know, arteries, vein, and then bone. And the tourniquet works by hopefully mostly putting equal pressure all the way around the circumference of that extremity to get that blood flow shut down. So that's the basics of how a tourniquet works. So I want to go 2 to 3 inches above the injury. I don't want to put the tourniquet on a joint, and I don't want to put the tourniquet over a pocket with phones, keys, or knives, or whatever else, because again, that's going to mess up and prevent that tourniquet from putting on the correct pressure the way it's meant to. It is okay to put a tourniquet on over clothing, blue jeans, long sleeve shirt, whatever, so long as it's not over a joint or something is between the tourniquet and ultimately the skin underneath. Now, wintertime clothing and whatnot, you might want to think about removing the clothing, and we'll talk about that here in a few minutes as well. So we're going north of the injury, we're avoiding joints, etc. If, let's say I go back to what I said my injury was, let's say I've lost my arm from here down. Where the tourniquet might go is right over the joint or pretty close. If it happens to go there, then I'm just going right above the joint, okay? So not a big deal, I'm just going a little more proximally to that. There are, and look, I want to say this too. A tourniquet should not be viewed as, or most importantly, used as your go-to for shutting off just any sort of bleeding, right? We're looking for two things when identifying severe bleeding, and maybe we'll go into that, a deeper dive one day as well, but it's basically focused around volume and flow, right? A tourniquet's not meant for every single type of injury where there might be a little bit of bleeding. You know, we're not going to put a tourniquet on our finger, just as an extreme example. So that's important to note too. And if I don't have a tourniquet, or if the tourniquet doesn't, if the injury does not necessitate a tourniquet, then direct pressure is our friend. And I want to emphasize that strongly here, is a tourniquet is not the go-to in all cases. And so the default should always be direct pressure. But when I have a tourniquet and when the injury necessitates it through that volume and flow, I want to use the tourniquet. So I just want to get that out of the way here too. There are 3 important steps to get a tourniquet applied properly, with some small details in the mix. The first one is, once I have the strap threaded through the buckle, I want to pull it, cinch it down tightly. Do I need to stand on it and yank it down that hard? No. But what I want to do, the goal is, because again, the functioning part of this, once I get that strap down tight, the part that's really going to occlude the blood flow is turning this windlass and cranking this windlass down. The reason why I want to take out all the slack and get that strap, that band, that belt, whatever you want to refer to it as, the band tight and the slack taken out, is because the less slack in the band means that I got to make less effort with the windlass. And so I've taken out all the slack. I got it cinched down pretty tight. I got that strap going out of the way. Most of these involve hook and latch, or hook and loop. Sorry, I always say latch instead of loop. Don't know why. Hook and loop. So you just want to push it out of the way. The second most important step, and probably the most important step after that, definitely, is turning of the windlass. And that is what's actually putting tension and drawing that band up, creating that circumferential pressure that we mentioned earlier. That's what's doing that. And so I'm gonna keep the pressure off my arm here. And just as a sidebar note too, if I've opted to help someone and render aid to someone, you know, you've heard the term bedside manner, and that's part of it. So being nice, keeping the conversation going lively as much as you can. The other piece to that is empathy. Not everybody knows what empathy is or how to deliver it, but in the spirit of empathy, one of the things that you want to talk to your patient is the fact that you want to let them know that you need to get the bleeding stopped as sooner than later, and that you're using a tourniquet, and tourniquets are going to hurt a little bit. They're quite painful once you start strapping down. Even with the strap tight, it's cutting off blood flow, doing its job, right? But you want to have the empathy enough to be talking to them, keeping them relaxed, and letting them know that you need to do this and you're sorry, but it is going to be quite uncomfortable and possibly hurt them. So get that out of the way as you're putting it on. And then as you turn the windlass, you're turning it until such time one of two things occur. One is you're watching the injury. Have you shut off the flow of blood? Have you occluded the blood flow? That's your first sign that you've twisted that windlass enough. The second thing that might happen is you run out of ability to twist that. I mean, you have twisted that windlass, you know, as far as it'll go, or at least as far as you can get it. Those are the two things you're looking for. We'll talk more here in a minute about what to do should the blood not be stopped once you get the tourniquet applied and you get that windlass cranked down as much as you can. So I've cranked down the windlass, probably more than the half the turn that I'm doing. And then the third step to this is that we're going to put the windlass into the windlass clip, or the windlass hook, as some refer to it as. We're putting that windlass into the clip. Why is that important? Well, we've made all this effort of cranking down this windlass. We don't want it to unwind. And you know, the analogy I use, do you remember the balsa wood little toy planes that you may have had growing up? That you put the rubber band on the prop and you twist up the prop, and then when you let go of the prop, you send it off and the prop spins with the rubber band being twisted up. It's basically the same principle as that. So I want to put the windlass, it's not enough just to crank the windlass down, that's great, but what are you going to do with it after that? It's important to put the windlass as the third step into its clip, or its hooks, if you will, to keep it from backing off again. And no, it does not matter which way you twist that windlass. And you'll know when you slide it into the clip which way it naturally wants to go to, and that's perfectly fine. And technically, we always talk in terms of the three most important steps when applying a tourniquet, but technically the fourth step is to take the clip strap over the top. On this particular tourniquet, which is, if I didn't mention already, it's a North American Rescue Cat. I believe this is a Gen 7. I know they're up to Gen 7 now. This is not only serving as a strap over the windlass clip or hooks, which serves to keep the windlass from popping out of the clip, but it also is the place to mark your time too. So those are the three, technically four steps that are most important in getting a tourniquet applied properly. I'm going to take this off because my arm is telling me it's time to get some blood flow back to it, which is great. If you do take training and have a course with the use of tourniquets, which I recommend that you do, you're going to want to be open to working with partners and not just applying tourniquets to yourself, but applying tourniquets to others. I do not ever want to encourage anyone to hurt their partner, but I will say, don't just slap it on real loosey-goosey and, you know, play with the tourniquet and be like, okay, I got it, I'm done. Put a little tension on it. Don't hurt them. You don't have to twist it up to the point where they got their blood flow completely tied off. If you've done it right, it won't take much where they're going to feel some numbness and tingliness and whatever else. But I want you to know what it's like to put it on. So I'll say that too and stop there. So I think we've covered the basics of the application of a tourniquet. Again, a tourniquet should not be viewed as a go-to for all types of bleedings. It has a specific purpose, with direct pressure always being the go-to. I did mention I do want to mention one other thing, going back to the windlass. And again, one of the main point of getting the windlass cranked down is to stop the flow of blood. If you've twisted this windlass as far as you can get it, or as far as it'll go, and the bleeding has not completely stopped, and you have a second tourniquet, what you would do is put that tourniquet north of the first tourniquet. Put the second tourniquet proximally to the first tourniquet, and then you want to keep just enough space between the two where you've got room to twist that windlass. And I'm spitballing here, but I would guesstimate that that's about a ½ inch to an inch. I'd say an inch just to be safe, because if you don't give yourself enough room, then you're going to be knocking into the first tourniquet you've put on. So if you can't get the bleeding stopped and you have multiple tourniquets, you put that second tourniquet proximally to the first. If by chance you don't have a second tourniquet, because maybe you felt having one in the kit's good enough, and again, I recommend you going back and watching our video on staging tourniquets. If you happen not to have but one tourniquet, then that's the time to go back to direct pressure to get that bleeding stopped. So with that, we'll stop. And in the next video, we'll talk about and show you some of the nuances of the 3 of these approved windlass-driven tourniquets. Thanks so much for watching. If you've liked what you've seen here, be sure to like our videos, subscribe to our channel. We're trying to put out all different types of content to see what you might like and what might resonate with you. Being kind of more the first aid individual in our organization, at least right now, I've been focused on more of the medical side of things. But let us know. Let us know in the comments if you have questions, if we didn't point out something just right. Again, be gentle. This is meant to be a basic overview for the most part. But like and subscribe to our channel, like this video, go back and watch the previous videos in the mini series on tourniquets, and be on the lookout for the next one coming up here soon. Thanks so much, and we'll see you soon.